Standardizing the transfer process from EMS to ED staff is critical for patient safety. It will avoid chaos, create an organized process to transfer all equipment and patient, and complete the transfer quickly and safely. Process involves EMS providing a clear clinical picture, gathering of hospital resources, notification of physician and staff, room preparation and staff staging, EMS arrival and patient transfer, a timeout called by the ED physician, which includes EMS Attendant in Charge, AIC, provides patient report, acknowledgement, and closure. Additional EMS staff may be requested for assistance.
Riverside Doctors, Williamsburg Medic 10, this is Israel. How do you copy?
This is Doctors Hospital. Go ahead with your report.
Good morning, Riverside. This is Williamsburg Medic 10. Currently, I'm out to your facility with about a 6-minute ETA. Coming to you with a 72-year-old male from Riverside Nursing Home. Do you have any questions or orders?
No questions, no orders. Trauma 1 on arrival. Please advise of any change in patient condition and route doctors clear on the here. This is Victoria Doctors Hospital. We have a critical alert coming to Trauma 1 in the ER.
It's important to have a process by which we set the room, having a set place for imaging, lab, primary nurse, secondary nurse, medic, and physician. Staging of the room allows the primary nurse and the physician to do an assessment of the patient, working from the patient's right side, while the rest of the team works at the patient's left side. Staging of laboratory and imaging is outside the room. Registration is set outside the room to gather information and execute the chart. It is vital to prepare the room with all necessary equipment and personnel before EMS arrives with the patient. Once the patient arrives in the room, transfer the respiratory equipment first with respiratory therapist. Then move the patient from the EMS stretcher to the Riverside Doctors Hospital stretcher as seen. Then transfer additional patient care monitoring equipment over to the RDHW staff's equipment. Finally, get the stretcher out of the room so the physician and primary nurse can do an assessment and receive a report from the EMS provider during the EMS timeout.
All right, now that he's on the monitor, I'd like EMS to give us the reports. I'd like a timeout in the room, please.
Okay, this is Mr. French. He is from River Dent Nursing Home. Staff there stated that he became altered this morning. They noticed he was having a little bit of trouble breathing and also did have a fever. On our arrival, he was in some pretty moderate respiratory distress. We put him on the monitor. He was sat in at about 76% on room air, respiratory rate of about 30. On the monitor, he was sinus tach at a rate of 130, does have a temperature of 101.1. Blood sugar and a 12 lead were normal. We established an IV, given him a little bit of fluids. He was initially hypotensive, and we've gotten that up a little bit. And with the CPAP, we were able to bring his saturation up to 89%.
Okay, great. All right, Avis will keep him on the CPAP. Let's get a gas, and we'll start our sepsis protocol.
After the timeout, a patient care report will be presented by the EMS provider attendant in charge. It is the physician's role to initiate a care plan and communicate with the primary nurse, who will place orders and direct her staff to perform those tasks that are needed to care for the patient.
All right, guys, still pretty lot of rhonchi bilaterally. Let's keep them on the CPAP. We'll get the gas like I stated. It's still a little clammy, so let's make sure we start the sepsis protocol. I need a second IV, and let's start that fluid resuscitation per protocol.
Okay.
These important steps in the transfer process will help us maximize patient safety.